Yes.
Hi.
Hi.
Good morning.
Good morning. I'm Dr. Karen.
Hi, nice to meet you. My name is Elena.
Hi. How can I help you?
Well,
Let me close it.
yeah, sure. Well, I've been having the flu. I had a cold, but I think it's not normal. When I coughed yesterday, I saw blood, and I really got worried because I just thought it was a simple cold. But, well, it got me scared, so I came here.
Oh, okay. Well, I'm going to begin the consultation asking about your personal life, some personal questions.
Yeah, sure.
First of all, what's your complete name?
Miliana Tizot Guzman.
Okay. And how old are you?
I am 26.
Do you work or do you study or?
I actually work. I work at a vet, so I work with animals all day.
Okay. And do you know how much do you weigh?
I think I weigh like 50 kilos.
Okay. Are you married?
No, I am engaged. I am getting married next year.
And do you have children or?
No,
Okay.
not yet.
Okay, so your main complaint, you have been coughing a lot, right?
Yes, a lot, and yesterday was with blood, so.
Any other symptoms that you have been feeling?
Well, as I told you, it was like I thought it was a cold, so I've been sweating a lot and fever and, well, headaches, but basically nothing like I got scared, so only that.
And when did you begin to feel you like that?
It was like 4 or 5 days ago. I went out with some friends last week, and one of them was very sick, and she was coughing a lot, and she had headache and stuff. But I thought she had the cold, so I thought I might have got it, but maybe I didn't get that. It was something else.
And do you know if your friend had any special illness, like?
No, I didn't ask, but I thought she had the cold only.
Just the flu?
Yes, flu, yes, normal.
Okay, and do you have any other, have you noticed that you lost weight?
Well, actually, yes, since, well, I told you last week, I've not been feeling very well, and yeah, I had been losing weight. I don't know how much, but I had noticed it, and I also lost all of my appetite. I don't want to eat anything. I don't like anything, and that's very weird because I like to eat a lot. I also noticed that I have very low energy at work. I always was very active and very energetic, and since the past week from now, I've been I always want to sit down, I always get tired and stuff like that.
You have no energy, right?
No, nothing.
Okay. And how often do you cough? Is very often or is not?
Well, yeah, it is. It is very often, every day, all day.
Okay. Okay, and so now I'm going to ask you something about your past medical history.
Yes.
So I'm going to ask some little questions. Have you had any neurological problem?
Well, I had migraine since I was a kid, but it's been controlled with medicine since I was little.
Any eyes problems?
Well, normal. I use glasses and stuff, but nothing important.
Have you broke any bone?
Yeah, I broke the tibia when I was a kid, and I had surgery for that, but it was a minor surgery, nothing.
Okay, any other surgery?
No.
Have you been hospitalized any other time?
Only because of the surgery, but no.
Okay, do you have any cardiovascular problem or any respiratory problem?
No, nothing.
Okay.
Not till now.
And about your childhood illnesses, when you were a child, do you know if you had any important?
Well, I had chickenpox, I think, like every kid, but not that I remember. All the migraines, it was very weird when I was a kid, but it got controlled.
Okay, so about your menstrual periods, are you regular and everything is normal with that?
I've always been normal, yes.
Okay, and this is a very important question. I'm going to ask you about your immunizations.
Okay.
Do you know if you when you were a child, if you have the BCG vaccine?
No, I don't think so.
Well, because this is the vaccine that can prevent the tuberculosis infection. About your symptoms and about the things that you are telling me, I'm not sure because I need to do some tests and I need to make a physical examination. But the cough with the sputum and blood is very common in patients with tuberculosis. But don't worry, it's an infection in your lungs. but with a treatment, you will be okay, right?
Okay.
About your family, do you know if they had any important disease?
Well, my dad has diabetes, but I don't think it's very serious because he's completely controlled. And my mom is hypertensive. She had some events last year, but she's on meds and she's fine. That's it.
And about your lifestyle, do you do exercise? Do you smoke? Do you drink alcohol? Anything that you think it's important in your
Well,
life?
I don't do much exercise. I am very busy. I go like to the gym or to some class like twice a week, but well, it's a minor exercise. I do go out sometimes a lot with my friends, and I do drink. Maybe it's not that much, but it's very regular, and I do smoke too. Sometimes when I get stressed and stuff like that. But that's it.
And do you eat healthy, or what do you usually eat?
Well, I not very healthy, but I do cook, and well, it's home cooked meal. So but no fast food. I do like salads and stuff like that.
Okay, that's very good. So now I'm going to make a physical examination. I'm going to take your pressure, and I'm going to put a thermometer to see your temperature.
Okay.
And then I'm going to hear your heart, and I'm going to hear your lungs, because that's the normal and the specific thing that I have to do about your symptoms, right?
Okay.
Okay. Could you please take a seat on the bed, please?
Yes.
Okay, I'm going to begin taking your pressure.
Sure.
Could you please? Yes. Okay, your blood pressure is right, it's normal. Okay. So I'm going to hear your heart and then your lungs. Please breathe normally.
Okay.
Okay, everything is normal. Just like maybe some arrhythmias in your respiration, but it's very normal.
Okay.
And I'm going to take your temperature.
Okay.
Could you please with your arm? Try. We're going to wait some seconds.
Okay. So you think it's like very serious or something?
No, don't worry. Well, it's not like it's a very normal infection, but you will if the tuberculosis is positive, if the test is positive about the tuberculosis infection, okay. You will need a treatment, and the treatment will last about 6 months, and you will take about 4 antibacterial medications, but that's all. You will need to rest maybe during the first month. I will not like to lay at the bed all the month, but to rest as you can, as much as you can. Okay. But that's all. You will need to try to stop smoking, stop drinking alcohol during the 6 months of the treatment. This is very
okay.
Okay. I'm going to explain you more.
Yes, sure.
Yes, your temperature it's a little high, but that's normal about the infection. Okay. So now I'm going to send you to take some tests. Okay. And that test it's in the laboratory. They will examine your sputum on the microscope,
Okay.
and they will see if the tuberculosis bacteria is in your sputum.
Okay.
So if the test is positive, it's sure that we're sure that you have the infection.
Okay.
And they will make the test right now if you can, because you don't need to be without it. You don't need anything. They just will need to ask some tests.
Okay.
And then they will give you the results tomorrow, and please come tomorrow to show me the results, and then I will give you your treatment. If it's tuberculosis, and I'm going to explain you the treatment.
Okay.
And if it's other thing, well, we will see. But I'm almost sure. But don't worry, you will be okay, right?
Okay.
So you can go.
Thank you very much.
Okay.
Well, see you tomorrow.
See you tomorrow. Bye.
Bye.
Hi, go ahead.
Hi, doctor. How are you?
How are you doing? You?
Thank you.
How have you been feeling?
Well, same.
Yes?
I had a lot of headache and fever and, well, not very good, but here are my results.
Okay. I'm going to
Yeah, sure.
check it, right? Yes, as I told you, you have tuberculosis. That test is positive. But don't worry, we're at time. The infection is like very early, so you don't have a lot of bad symptoms.
Okay.
So, as I explained you the last time, I'm going to prescribe to give you a treatment.
Okay.
It will last 6 months, and it's very important that during that 6 months you will eat very healthy. You need to eat a lot of vitamin C, especially about infection. You need to drink your medicine. It's four pills,
Okay.
and you will eat 2 at the morning and 2 at night, right?
Okay.
And then that's all. You will need to rest a lot, as much as you can. You need to live very well, to eat very well. If you can, you can try to do some exercise, but not very. Like, you can go walking, you can go to swimming in a slow
Okay.
manner, or something like that.
Okay.
That you can do, but you need to rest a lot. You don't need to be stressed and all of that. Okay?
Yeah, sure.
Okay, I'm going to give you, this is the medicine. You can go to the pharmacy and they will give you the pills. I think that you will need the medicine. You will need like 3 boxes per each pill, like for the complete treatment.
Okay.
So you need to come back in a month, right?
Okay.
And we will see how you have been feeling and all of the things. But if you don't feel bad, you can do everything normal.
Okay.
And if you feel any abnormal, any different, then you can call me any hour, or you can come. If it is before the month, don't worry, you can come,
Okay.
and I will check you, right?
Okay.
But this is your the medication,
Okay.
and that's all, right?
Okay. Well,
Okay. So if you find any doubts,
well, no. Will the symptoms go away?
yes, with the medication you will feel well,
Okay.
right?
Well, thank
Okay.
you very much.
No,
It was very nice to meet you.
thank you.
Thank
Nice
you,
to
everyone.
meet you too. Okay, bye bye.